Great. Hello and welcome everyone to the George and Fahey Center for Healthcare Innovation, or CHI, third session of the 2024-25 academic year of the Patient Engagement Lunchtime Learning Series. My name is Victoria Vasilkiv, and I will be the session moderator today. This series is accredited by the Royal College of Physicians and Surgeons of Canada as a group learning activity, and it may be eligible for credits towards requirements with other professional bodies. We have auto transcription enabled, which can be toggled on or off anytime using the captions button at the bottom of your screen. Should you have any questions or comments during the session, we invite you to submit them using the moderated Q&A feature, also located at the bottom of your screen. This session will be recorded and available for viewing afterwards, and attendees will receive information in a follow-up email of how to access that information. For today's session, we welcome Morgan Stirling. Morgan is a queer, non-binary PhD candidate at the University of Manitoba in the Department of Community Health Sciences. As part of their PhD project, they are co-leading the CIHR-funded study Beyond the Binary, Gender Diversity in Cancer Health Research Service, which is a community-engaged research methods to improve how trans and gender diverse people are included and represented in cancer research using routinely collected data. Morgan has over a decade of academic and professional experience working at the intersection of cancer and health equity. A significant amount of that work has focused on efforts to transform the cancer system to make it more inclusive and safer for queer and gender diverse people. Recognizing that there are many approaches to doing this important work, Morgan ultimately decided to focus their energies into research and to addressing a clear gap that sexual and gender minorities are routinely engaged in discussions for efforts to make cancer care services and treatments more equitable for them. As PhD candidate doing community engaged research for the first time, Morgan recognizes they still have a lot of to learn, but is very grateful to be working in a space that can and will hopefully result in meaningful change for their community. Welcome, Morgan, and I'll turn it over whenever you're ready.
All right, thanks, Victoria. It's always fun when somebody asks you to submit a bio and then you send it months in advance and then you hear it again and you're like, oh, that's what I said. Always fun to hear hear those comments. So let me pull up my slides. And so I think, come on. Play from current slide. And so, all right. So you are now seeing we're good. Okay. So yeah, thanks Victoria for that very generous introduction. I'm very excited to be here and talk a little bit about the work that I've been doing for the past couple of years. I understand that we have to, for accreditation purposes, we have to go through the disclosures. So I just want to let folks know that I receive a stipend from both Health Data Research Network Canada, as well as the Canadian Institutes of Health Research, who are providing financial support for this project. I stewed about how to mitigate potential bias because I don't really see how there's a whole lot of potential influence from those entities in this project. So suffice to say is I'm doing this with their support, but without any real oversight from them. And I do want to acknowledge that I live in Manitoba. I'm here in Winnipeg, but I've also lived across many treaty areas in the province. I am grateful for the First Nations, Métis, and Inuit folks who have been the stewards of the land that I come from, but acknowledge that as a white settler, I have directly benefited from the exploitation of the land and the resources that Indigenous peoples have traditionally been the protectors of this place. I still have a whole lot of learning as well as unlearning to do but I'm committed to finding ways to minimize the harm that my work has, as well as finding ways to connect this work with larger efforts to promote reconciliation. And I'd also like to note that this project has received funding from a few different entities, including the Canadian Institutes of Health Research, as well as CHI, who has provided funding through the PrEP Award to help with some of the engagement that we are doing in this project, as well as the Canadian Cancer Society. Also want to note that tomorrow is the launching date or the beginning of Transgender Awareness Week. And I was doing a little bit of searching, and I don't know if this is ironic or not, but I could not find anything in Manitoba, either at the University of Manitoba, across the healthcare organizations, around Transgender Awareness Week, but did want to note that that starts tomorrow. And on November 20th will be Transgender Day of Remembrance. And so as it relates to this project, I do want to note that, while I am leading the Beyond the Binary project, there is a very large and diverse team who is providing incredible support in many different ways. So of course, kind of central to this project is having a community advisory board comprised of trans and gender diverse folks across Canada. We also have local as well as national organizations who are being with their role within the project is around knowledge users. And in terms of folks who bring more of that research expertise, we have folks across Canada from a variety of disciplines, who are all involved and committed to finding ways to improve how trans and gender diverse folks are represented and included in cancer research. And so within the next 40 minutes or so, my hope is to be able to describe the challenges with measuring sex and gender, talk a little bit about the evidence base related to trans and gender diverse folks with cancer, and then also talk more specifically about the project and the importance of engaging trans and gender diverse folks in cancer research. And if folks have seen me present on some of these slides before, you'll have seen that this is a slide that I regularly use in my presentations. And I've tried to find other quotes that I think can do a good job of kind of summarizing it, but I keep coming back to this quote from Ray Spoon, who is a non-binary Canadian musician. And the quote here was taken from their Medium page, which is a platform that they have used to share multiple parts about their cancer experience. And why I keep coming back to this quote is it's so evident that Ray is clearly describing, their erasure and invisibility of being a non-binary person in the cancer system, and how that has had some very significant negative impacts on their experiences as well as potentially their outcomes. And I think that really connects a lot to the motivation for this project, is that this invisibility that occurs specifically within the cancer system is also replicated in cancer research. We don't have good ways of measuring gender and gender diversity, and that makes it really difficult to develop evidence-informed or evidence-based interventions to address or get rid of that invisibility and erasure. So to kind of get us going, start with objective one, which is describing the challenges with measuring sex and gender. So really just to kind of get us going, when we're talking about sex and we're talking about gender, I think it's important to operationalize those. So when we're talking about sex, what we're really talking about is a characteristic that is based on primary and secondary sex characteristics, things like hormones, reproductive organs and functions, physical traits like breasts, facial hair, as well as other biological or physiological attributes like chromosomes or gene expression. We often see sex on legal documents, so like on our passport, health insurance, driver's license. And while gender and sex are distinct aspects of who someone is, both sex and gender, this kind of respective meanings and aspects of someone's identity are intertwined. So by that I mean we experience our gender in ways that is informed by our sex, so that it aligns or it doesn't. And we typically categorize sex as either female or male. But I think it's really important to underscore that this is a far more complex binary than we typically understand it to be. There is significant variation in the way the attributes that make up one's sex varies across individuals. So hormone levels will differ, reproductive organs can look different, and they don't all function the same way. We often think about chromosomes as XX being female and XY as being male, but some people have additional chromosomes without ever knowing about it, but their legal sex and the way they understand themselves may be male or female. And I highlight this as a way to, kind of put a bit of a earworm, if that's the phrase, that we often take sex to be an unmutable attribute that means the same thing for everyone. But there is significant variation within these categories that we don't typically examine. And so, kind of moving then to gender and how it differs from sex. Gender is understood to be a term that describes a person's social and personal identity as a man, woman, transgender person, or something between or beyond those identities. It's really a way to describe how people express themselves, both to the outside world, how they understand themselves, as well as how the outside world understands individuals. And we're all socialized from early on in our lives to understand and recognize gender in the way that people walk, the way people talk, the way they behave. And typically that socialization revolves around men and women and how we should be understanding them as different. And throughout our socialization, which starts as early as basically we are in uh, the womb, we all enact gender in our day-to-day life, whether that's through adhering or challenging norms, as well as the roles that we take in the relationships that we have with others. An individual's gender expression may or may not conform with their gender identity, and their gender identity may not correspond to the sex they were assigned at birth or what's on their legal documentations. And here's some language that you may have seen or heard to describe someone's genders. So girls, boys, men, women, two-spirit, trans, gender diverse, and the list can and does go on and on. And then to kind of like center this in the focus of this project, when we're thinking about gender, and there's often this question of who are trans and gender diverse folks. The easiest way to understand who trans and gender diverse folk it's a kind of an umbrella term to describe individuals whose gender identity and or their gender expression is not aligned with their sex assigned at birth. There's a really common narrative for this population that there is some type of transition, oftentimes kind of focusing or centering on a medical transition where people will take hormones or have some type of gender affirming surgery. And for some trans and gender diverse folks, that can be their story, that can be their experience. But for a lot of trans and gender diverse people, that type of transition is not necessarily part of their journey. It's really just that experience of their gender identity not aligning with their sex assigned at birth. And so one of the things that was pretty cool is in the most recent census is this was the first time a country has been able to report systematically on the number of trans and gender diverse people in Canada. So with the most recent census, what was found was about 0.3% of the population in Canada who were 15 and older reported being trans or non-binary. And how this is, why I think this is important in terms of a kind of the cancer context is we often think of cancer as being a disease that occurs in older folks. So it's kind of understood to be a disease of aging. And with respect to the trans and gender diverse population, almost 2/3 of the population were under the age of 35, which isn't the typical age when people start getting diagnosed with cancer. And so, currently we might not be seeing a high proportion of trans and gender diverse people being diagnosed with cancer, but it can be assumed that as this population continues to age, as this population continues to grow, this will become a more common population encountered by cancer care providers. And as such, there's a real imperative to improve the systems to be able to meet this population's needs. So now that is kind of the layout of who trans and gender diverse people are, what's the scope in Canada? I do want to talk about as this relates to measurement and the ways gender diversity is currently captured in data. And so I'd like to start first with the Canadian census, which I just talked about. And so, as you'll see, these are the questions that were used with the most recent census. So, two questions were asked: What was somebody's sex at birth? And then, what is a person's gender? And so, with this particular approach, the way they categorize trans or non binary people was individuals whose sex assigned at birth differed from their gender. So, people who responded, for example, say male sex at birth, female gender, those people would be classified as transgender. Non-binary people would be individuals who responded to the gender question as, or please specify this person's gender. Um, and so, this is, there's a lot of things going on with this particular approach. First is noting that the language between sex and gender is consistent. So using sex-based terminology to define somebody's gender. And in addition to that, really lumping a very diverse population as non-binary within the one response option, recognizing that there are a significant number of gender identities who is not captured through this particular process. And so in 2021, a couple of years ago, after the census rolled out, there was further engagement and consultation. And so what the plan is, my understanding is subsequent iterations will modify the gender category so that it is more consistent with terminology related to gender. But again, we're kind of sticking with non-binary as being an option to capture people who are the multiple gender identities that are for individuals who do not identify as trans. And so another way that sex and gender data is captured is through electronic health records. And there's a lot of research on this particular aspect. And there is a very strong and clear consensus that EHRs or electronic medical records are not good data sources for collecting gender identity or gender data. So the slide here has a picture of a mock patient. And you'll note that there's a red box. And that red box is around sex. And that is because there is not a gender field for this particular electronic health record system. And so some EHRs do have a gender field, but very common what we find with those is that even though they have a gender field, what happens is that they use terminology that is more consistent with sex. And that's problematic because it kind of reinforces this understanding, this pervasive understanding that sex and gender are the same thing. Um, And another way that sex and gender are included is through registries and surveillance systems. So for my work, I'm primarily focused, for example, on the Manitoba Cancer Registry or the Canadian Cancer Registry. And these are population-based registries that collects information about new cancers in respective provinces or in Canada. And how those fields get populated is through kind of like a funneling of information from electronic health record systems. So in order for information in these registries to reflect somebody's real identity, that information needs to be captured in the real way from the electronic health record. And as it stands with cancer registries, the North American Association of Central Cancer Registries, which is the entity that oversees data standards, do not currently have a gender field, but instead have a sex field. And then the final point I'd like to mention is related to data standards. And just note that there is a lack of consensus for how sex and gender should be captured. So the image on the slide is from Kai Hai's recommendation for how to report on data and gender in data. And you'll note that these terms also use sex-related terminology. And the rationale for this is it's a way of facilitating an easier way to identify whether someone's sex at birth aligns with their gender identity or not. And I do want to note, like this is definitely an ongoing conversation in terms of what are the best practices, but note that currently within the existing infrastructure, it's just we don't have a good way of capturing gender. And part of the reasons why that happens is that I've kind of been out for over 20 years, and I've been on my own journey in terms of like what my identity is. And one of the things that is really apparent to me is that terminology and language in the space has changed, and it will continue to change, and it has expanded significantly. And so it becomes difficult to create appropriate variables or determine appropriate values for variables when our language is constantly changing. Another aspect is that gender as an experience and as an identity can be very fluid for a lot of folks. It can change on a ongoing, irregular basis. And so it becomes really difficult to capture this experience in a very neatly well-defined box. Because when we're talking about gender, we're really talking about someone's personal experience, which is very subjective. And it isn't something that kind of lends itself to fitting well in a box. And there's just questions about like what is the appropriate way to categorize everyone the same way when people who are using the same language might not necessarily have the same experiences with respect to their identity. And so oftentimes what happens is researchers will collapse categories to make the numbers in research bigger so that they can do the analysis that they need. But in effect, what that does is it continues to flatten the diversity of experience that exists within those categories. And I realize I'm kind of just like pointing out the problems, and that's a way of kind of like emphasizing that this is a very complex issue. and that people are working in this space to try to find ways to improve. But it is just a very difficult challenge. And then the last point I'd like to kind of emphasize here with the complexities of measuring gender is that a lot of the data that we get for cancer health services research or routinely collected data occur more so in the clinical type setting. So this data is collected typically for a purpose other than research, and it is often healthcare providers or clinicians who are collecting that information as part of their routine interactions with their patients. And it's very well established in the literature that trans and gender diverse folks hesitate or choose not to disclose their identity to healthcare providers out of fear of discrimination or receiving poor care. And so when we're thinking about how to improve, how to collect and use gender data, we also need to be thinking about improving the safety of trans and gender diverse folks to be able to disclose this information. So we've kind of defined the problem. You know, there are some very significant limitations, both structural and practical, with how gender identity has been measured. Our opportunities for improving how gender identity will be measured, and then how does that kind of translate to our ability to investigate trans and gender diverse folks' health and cancer outcomes. But would say that despite these challenges, folks persevere, so to speak, and are really invested in doing the research in the area of cancer and also transgender health to help kind of build the evidence base in the best ways that they can. And before kind of talking about trans and gender diverse folks in cancer, I do want to talk a little bit about evidence related to trans and gender diverse folks' health generally. So I'd just like to highlight this review here, which is fairly recent, earlier this year. And just want to highlight that the findings within this review, and I think it's a really helpful review if folks are interested in this topic, and was really about kind of mapping where research on transgender health has occurred. And what they noticed is that research on trans and gender diverse folks in health has focused primarily on mental health, and in particular, emphasizing that trans and gender diverse folks have a high burden of mental health issues as well as substance use disorders. The second area that has received a significant amount of attention is around sexual health. And in particular, there's a strong focus on sexually transmitted infections and HIV among trans and gender diverse folks. And then the third area of major focus was around violence and victimization and rates that trans and gender diverse folks experience violence. What is underrepresented in general health or what is underrepresented in this health research is kind of the areas of general health as well as chronic non-communicable diseases. So in this review, cancer was only represented in 1.6% of all studies. And why I think this is a problem is it suggests that cancer is not a priority for this population. But I think even more important is that when we're thinking about the evidence on trans and gender diverse folks' health, if the emphasis is on research related to mental health, substance use, victimization, sexually transmitted infections, HIV, then this is the narratives that we are going to start creating around trans and gender diverse folks. And that influences the stereotypes and our understandings of this population. And it minimizes everything else that's going on for trans and gender diverse folks in their health. So what does the 1.6% say about trans and gender diverse folks? Quite broadly, trans and gender diverse folks are at risk of experiencing inequities along the cancer continuum. This includes discrimination from healthcare providers within the health system. There's also an understanding that there's a lack of relevant psychosocial support or clinical treatment guidelines that include or discuss trans and gender diverse folks' experiences. And there's also some research to suggest that trans and gender diverse folks may be at risk of delayed or receiving a later stage diagnosis for some, but not all cancers. And so it's kind of within this context that we decided we needed to do a little bit more work. So, I've been doing this. This is what my PhD is focused on. So as part of that, I've done a literature review, and within kind of like the scope of the research on this topic, there's definitely been some literature reviews quite broadly on the topic of cancer, but these tend to focus on discrete parts of the cancer continuum, like screening, psychosocial care, or we're focused on including a small number of a particular study design. And so within this kind of review of the literature, we identified a gap, particularly as it relates to systematically exploring the methodological approaches and the characteristics of studies investigating trans and gender diverse folks with cancer. And so to kind of look at that, we've designed and conducted and are finalizing a manuscript with our own scoping review that is looking at how trans and gender diverse folks are described in cancer research, as well as how trans and gender diverse people's cancer outcomes and experiences are investigated. And so in the interest of time, I'm just going to skip to the juicy bits and go to the findings. If you have more questions kind of about the methods of the scoping review, free to talk about them. But I think people are generally just like, so what? What do I need to know about this? So with respect to the first objective, there were really two elements that we were most interested in. First was around the terminology used to describe trans and gender diverse folk. As we might expect, there was significant variability in the terminology that was used, but generally we could kind of categorize it as being one of two approaches. The first was to talk about trans and gender diverse folks using an umbrella term like transgender or non-binary, gender diverse. And many of the studies that did this, one of the issues that we noted was that they failed to acknowledge that there was a diversity of individuals and identities that exists within these umbrella terms. And so inadvertently happened to kind of reinforce the narratives or understanding that all trans and gender diverse folks experience or share the same experiences. The second approach was for studies to kind of refine trans and gender diverse folks into more specific categories, typically based on participants' current gender or refer to individuals on the basis of their sex assigned at birth. And that is a helpful approach for kind of acknowledging that there is a broader diversity of experiences, but there was a lack of consistency in the terminology used, which makes it really difficult to determine what results relate to which particular groups and then generate some strong conclusions. And so in addition to that, we were also interested in understanding how trans and gender diverse folks were operationalized in studies. So just over 2/3 of the studies included some type of definition. And among those, over 90% of the studies referred in some way to this misalignment between gender identity and sex assigned at birth. One of the things we did note, but we maybe weren't as surprised as we could have been, was that several studies define trans and gender diverse folks in ways that reinforce narratives based on anatomy or the belief that all trans and gender diverse folks undergo or want to undergo a process to change their biological sex. And for some, as I've said, for some trans and gender diverse folks, that is true, but it is not a defining characteristic of being trans and gender diverse. And so this kind of reinforces that erasure of trans and gender diverse folks who choose not to undergo gender affirming surgeries for a variety of reasons. And so with respect to the second objective, there were some key results I think that I'd like to highlight in terms of how trans and gender diverse people's cancer experiences and outcomes were investigated. So the first point I'd like to highlight is that a significant number of studies use the same sample in their respective study. So 15% of studies use data from the behavioral risk factor surveillance system, um, which is problematic for a variety of reasons, notwithstanding that there's been some methodological issues about how the BRFSS captures gender diversity. For a while, it was based on the timbre of somebody's voice rather than asking people to identify. And in addition to that, we included reports from the same specialized gender identity clinic because they tended to report on similar but different elements. And so why that's important is that it really demonstrates that there's a lack of breadth in the data that is used to report on trans and gender diverse folks' cancer experiences and outcomes. We have a very small set of people who are constituting the entire evidence base for this population. And then another significant finding is that only we ended up including 55 studies. So only 6 of those studies reported formally engaging trans and gender diverse folks in their studies. And this is important for a variety of reasons. Perhaps most importantly is that, within the kind of the field of health research and particularly equity oriented research, is that there's a really strong consensus that it's imperative to engage equity deserving groups for minimizing the impact of oppression that has often occurred through the research processes. And so based on the results of the scoping review, there's some key points I want to kind of emphasize here. The first is that, as I've noted, there are issues with and challenges with measuring sex and gender, which impacts the ability to conduct high quality research. When we think about the research base itself, we really can understand it to have a fairly narrow scope of who is included in this research. So I would say that we don't have a representative evidence base to be really making decisions from. And then finally, we really have noted that there is not a strong engagement with trans and gender diverse folks in this area. And so that's where the project that I'm working on comes from. So, this is a slide, a high level overview of the work that we're doing. This is the Beyond the Binary Gender Diversity in Cancer Health Services research, which is a goal to be able to advance cancer health services researchers' capacity to meaningfully integrate trans and gender diverse folks and their priorities into cancer research. And the process that we're going to be doing, it is a community-based, multi-phase, mixed methods study. And in the first phase of this project, we are conducting what we're calling an environmental scan, which is really focused on describing the landscape of how gender and gender diversity is measured and used in Canadian cancer health services research. And so 2 parts to this includes a research and data infrastructure scan. So we'll be looking at data repositories like Manitoba Centre for Health Policy to summarize how and where sex and gender measures and data are captured. We'll also look at routinely publicly available, routinely collected data. So looking at things like data dictionaries, coding schemes, trying to understand more about the way they define and operationalize gender in those data. And then using results from this environmental scan to develop key informant interviews with folks who are kind of responsible for administering the cancer systems, data infrastructure, with a view to understanding more what is the current data structures, what are the current processes, as well as what are some opportunities for improving how gender is collected, stored within these data systems. And so that phase is happening at the same time that phase two is happening, which is really the bulk of my PhD project. And this is what we're calling the needs assessment. So we've got two aspects of this particular study. The first is a needs assessment survey with Cancer Health Services researchers, trying to get an understanding of their understanding of gender diversity, what barriers they encounter, what facilitators do they know of or have they used in their work for including gender and gender diversity in their work. And then using results from that needs assessment to inform focus groups with trans and gender diverse folks across Canada, as a way to kind of respond to, these are the problems that researchers are encountering. These are the things that they think they are doing well. What are your thoughts on that? How can we best address the needs of trans and gender diverse folks through addressing these limitations? And then in the final phase, we're going to be integrating the results. At this point, we're still figuring out what that's going to look like. It's not a fully realized idea, but stay tuned. Maybe once phase two is done, we'll have a better understanding of how we can bring phase one and phase two together. And so, as I have kind of emphasized or described, one of the major elements of this project is that it is really very much grounded in community engagement. And so for this project, we have convened a community advisory board that has 11 folks who are trans and gender diverse across Canada, variety of experiences with cancer. Maybe they're a cancer patient, maybe they're a caregiver, maybe they've been involved in cancer screening, and through this project are really working on collaborating with our advisors. So to the fullest extent possible, we're trying to incorporate their feedback and their perspective into decisions about what to do, and what we need to prioritize. And in our work, I would say that it's guided by 4 principles. The first is partnership. So this has included developing in terms of reference, emphasizing the importance of community advisors' perspectives in team meetings, as well as in follow-up discussions, being transparent about the limitations of the project, as well as my own newness to doing this type of work. There's also a commitment for mutual benefit. So we're providing an honoraria for the community advisors, providing opportunities for them to be involved in the project in ways that they want to. So possibly presenting, involved in developing manuscripts, really emphasizing the importance of their contributions. There's also a commitment to co-learning. So from a team perspective, most of this has been around sharing about the research project. And for me, I've learned a lot in my community advisory meetings and in smaller discussions. They're a really insightful group of individuals who have really had a profound impact in terms of how I see this project and the decisions that we need to make. And then also a long-term commitment. So as was mentioned in my introduction, this is an area I've been working on for over 10 years. I don't intend this to become something I'm not going to ever really move away from. And so just some some things in terms of where we've gone, where we've started, and some reflections that I've had. As a group, we've met over 7 times. As I mentioned, we finalized the terms of reference, we finalized the study design, talked about the scoping review, which they've been involved in, and they've also been instrumental in finalizing the needs assessment survey, which I'm hoping will be implemented. I had been hoping December, but it's looking like it's more likely going to be January. But they've been kind of providing feedback through multiple stages and different iterations of the survey that's just really made it very exciting and grounded, I think, in trans and gender diverse folks' experiences. And then as I kind of reflect on this experience, I'm very new to this particular type of research. And perhaps one of my biggest takeaways is I went into this work with focus on research, right? We're talking about cancer health services research. What can we do to improve research? And I don't know, meeting 1, 2, or 3, it was very early on in this process, where the advisors really reminded me that the research that is produced comes from trans and gender diverse people's real experiences. So we need to find a way within this work to not just kind of get caught up in research as research, but also reminding ourselves that the data that we use, the data that is collected comes from real people. And alongside this, we need to be exploring how we can increase the safety and capacity for systems and people to collect that information in ways that is safe and inclusive. I'll also note that uh, 11 community advisors, all coming from different parts of Canada, different experiences with cancer and the cancer system. And it's just been so enriching for me, to be able, and I think for the research team. I don't want to speak for individuals' experiences, but I do think that um, it has really broadened our scope and our understanding of what we need to be looking at in this project. Um, I also want to reflect that in some ways, the engagement was easier than I thought. I really thought it might be hard to build those relationships with advisors, but they're all so committed to this work, and they're just lovely human beings that, like, the hardest part for me has kind of been dealing with the logistics of a national community advisory board and research team, that is proving to be much more challenging than the work. I don't like the logistics, but I love the opportunities to connect with folks. And as I was putting this presentation together, I was like, well, I can talk a lot about my experience, but I'm realizing that there's a real kind of gap in terms of the experiences of advisors. And so I definitely need to prioritize ways of collecting more feedback from advisors in terms of their experiences, and making sure that, while I think we're doing a good job as relates to our principles, I'm not sure what the advisors think. And so I need to kind of sit with that and kind of go back to them and find ways of, checking in a little bit better, because I think that's really important. And then in terms of kind of wrapping up, the final takeaways from this is, the existing approaches that we have for measuring sex and gender simply are just not adequate. And we see that by the significant gaps in the evidence around trans and gender diverse folks with cancer, as well as some really significant methodological issues, that I hope can be addressed by improving the ways we collect, as well as think about how we use data. Um, and it's really important to improve measurement when we're thinking about what we need to do. We need to engage trans and gender diverse folks. And this project is really trying to center trans and gender diverse people's experiences to address some of these limitations, definitely not all of them, but to kind of build a foundation for continuing to improve this area. And with that, I'd like to thank you. And here is my contact information.
Thank you so much, Morgan. So important and so timely to be discussing this today. I don't see any questions in our Q&A yet, but I'll give folks a couple of minutes in case they're typing things in right now. I'll also maybe open it up to our co-panelists in the background if you have any comments or questions.
I guess thanks so much for the presentation, Morgan. This was wonderful. I was thinking about how you were talking about engaging nationally. So I'm assuming online, virtually a lot. Are there things that you've learned over time around best practices um, for kind of creating spaces where people can share their lived experience, especially when it's on that virtual format? Are there things that you do to kind of open up that discussion?
Yeah, I mean, like, I don't know if I would consider this a best practice. I the way I we set this project up was we initially had a meeting with the community advisors, just kind of talking about the project, as well as giving a bit of description about who's going to be working with us. And then we met separately with the research team. And in that research team, we meeting, it was really important to kind of emphasize the importance of community advisors and kind of how we were going to be working to prioritize their perspectives. Um, the research team that is on the Beyond the Binary is amazing. They're all just like such lovely human beings that it wasn't a hard sell. But kind of thinking about that, one of the things we do at each of our like large research team meetings where the community advisory board meets with the kind of like what I'm calling the research enterprise side as a way to say these are folks who do research for a living. Um, we just emphasize the value of everybody's perspectives and just noting that people are coming from different places and it is kind of a collective thing, those diversity of experiences that's going to kind of enrich it. And so that seems to be working very well for us. But, you know, I know some folks have had much different experiences. I've got a great research team who really see the value in this, and so that makes it a lot easier, I think.
It's amazing. I love that you set the stage with the team to kind of, yeah, that those voices would be.
It felt it was really important, I think, particularly because folks are coming from different experiences and also providing a bit of an overview in terms of terminology around trans and gender diverse folks. Um, just so we're kind of like all operating from a very, very low. It was a very basic overview over some really complex topics. Yeah.
Thanks, Morgan.
Nice. We've got some compliments heading your way, Morgan, in the Q&A here saying excellent presentation. It was very clear. We also got a question. So you're basically currently exploring this work. If you could speak to maybe what are some of the current maybe best practices that do exist in collecting sex and gender data?
So the current best practice, I think that is most common, particularly from a clinical in a clinical setting, is kind of a two-step approach. One where you ask somebody about their sex assigned at birth. The second would be asking somebody about their gender. The other thing that I think is an emerging new practice is around anatomical inventories, which isn't really about collecting sex and gender data per se, but in thinking about what the role of clinicians are and where we get our data from. Our data does not, the data that we used in cancer health services research often comes from data that is not for research purposes. And so it's kind of a bit of a difficult balance in terms of like how do we collect meaningful sex and gender data while also prioritizing like what is important information that clinicians need to have to be able to provide the best care possible. And so is it important that we are asking about sex and gender, or are we asking about people's body parts when they're in those encounters? because if they're going for a medical issue, they need to know what body parts they are dealing with. But then there's also kind of like the more human element of it in terms of what do I need to know about people? How do I respectfully engage with folks? So, I think there's two kind of like parallel approaches that are gaining traction in terms of how we do this well and for what purposes, right? So do we need to know sex and gender from like a clinical perspective? Do we need to know body parts? What is the best information that I need to get in a way that will feel comfortable for patients and give the information that is needed so that clinicians can do their duty? And then from a research side, how can we best use those two kind of complementary sets of information about people? I don't know if that makes sense, but I would say like there's kind of two main ways of thinking about how to collect sex and gender information.
Very, very cool. So I think we're good on questions. So perhaps I'll give folks another few minutes back to their day. So we do have one other comment here. Just saying, I'll quote here. As an intersex person, I thank you for including intersex in your gender diverse lens. Many people like myself in Canada feel invisible on this point. The need for psychosocial support is greatly lacking, so thank you for your advocacy in this work. And that is a beautiful note to end on.
Thanks for your comment.
Take also just a moment to thank you, Morgan, for joining us today and giving your time and expertise to this session, and also our audience for attending today. I do like to note that you will receive information in a follow-up email just on how to access the slides and the recording from this session. We will be taking a break in December, but we do look forward to welcoming you back to the series in the new year. And then lastly, there will be a quick survey that pops up when you close this session. And I do really welcome you to submit your feedback. It is incredibly important for us to know. Also what kind of content you may be interested in seeing in future sessions, as well as your evaluation for today. So that will just come up when you close out of this. And thank you all again. And thank you, Morgan, so much. I wish you all a good rest of your day.
My pleasure. Thanks, everyone.